Breast cancer is the most common cancer diagnosed in women in the United States, other than skin cancer. It is the second leading cause of cancer death in women after lung cancer. The chance of a woman having invasive breast cancer sometime during her life is about 1 in 8. That is 1 out of 8 women expected to experience some form of breast cancer. The chance of dying from breast cancer is about 1 in 37. That's 1 out of 37 women dying from this disease. Breast cancer death rates have been going down. This is probably the result of the cancer earlier and better treatment, finding the cancer earlier and better treatment. Right now, there are more than 3.1 million breast cancer survivors in the United States. In June of 2011, I was diagnosed with invasive ductal carcinoma, grade 3/3, spanning 2.2 centimeters in my right breast. It was serious enough that doctors told me that my breast could not be saved. As I also was diagnosed with ductal carcinoma in situ with calcifications, intermediate grade, in the same breast. On September 30th, I had bilateral mastectomies, both breasts removed. To remove the cancer, I opted to have my healthy left breast removed as a security measure for less future worrying. From November 2011 until January 2012, I received chemotherapy. Chemotherapy was discontinued early due to inflammation in my left breast tissue expander. I was hard-headed and did not take the steroids. I didn't drink water like I was supposed to, or walk as I was directed to walk and exercise during treatment. The tissue expander was the beginning process of rebuilding my chest. My final surgery to reconstruct my breast took place in March of 2013. I had a total of 8 surgeries throughout the course of treatment. In October of this year, I will celebrate my 5th year in remission. The 5th year is the charm. It was a routine breast exam performed when I was 39, 1 year shy of the suggested age of 40 to begin professional mammogram. 40 continues to be the age that most doctors order breast exams for women. We all probably have heard of women in their 20s being treated and dying from this age. My early exam was the suggestion of my primary care physician. A female doctor was concerned about the feel and appearance of my left breast. I know that you must be wondering, why did I have breast cancer? Upon discovering that I was sick, I went on a journey of research to educate myself on why, the possibilities. Causes of breast cancer. Studies continue to uncover lifestyle factors and habits, as well as inherited genes that affect breast cancer risk. Here are a few examples. Several studies are looking at the effect of exercise, weight gain or loss, and diet on risk. Studies on the best use of genetic testing for BRCA1 and BRCA2 mutations continue at a rapid pace. Now, BRCA is considered a gene that is almost assures a high risk of developing breast cancer. My genetic test showed a high level of protein, not BRCA. Scientists are exploring how common gene variations, small changes in genes that are not as significant as mutations, may affect breast cancer risk. A mutation is when a chromosome, which is a piece of a gene, moves out of place. Gene variants typically have only a modest effect on risk, but when taken together, they may potentially have a large impact. Potential causes of breast cancer in the environment have also received more attention in recent years. While much of the science on this topic is still in its earliest stages, this is an area of active research. A large long-term study funded by the National Institute of Environmental Health Sciences is now being done to help find the causes of breast cancer, known as the SISTER study. It has enrolled 50,000 women who have sisters with breast cancer. This study will follow these women for at least 10 years and collect information about genes, lifestyle, and environmental factors that may cause breast cancer. An offshoot of the SISTER study is the Two-Sister study, which is designed to look at possible causes of early onset breast cancer. I have been in a study group called the Carolina Breast Cancer Study for 4 years to track the results of my breast cancer experiences, including treatment. Of these possible causes of breast cancer, I can personally tell you that at the time, I was not exercising. I ate fast food daily. I was 10 pounds heavier than my usual weight. I drank alcohol and experimented with marijuana. I began this unhealthy lifestyle in my early 30s while working in the healthcare field. Upon discovering that I had breast cancer, I began to consciously make efforts to change my lifestyle and continue to be aware of how I treat my body. And I can tell you that it is difficult. It is a difficult process in today's society, which moves me into what can be done to stay healthy. Reducing breast cancer risk. Researchers continue to look for medicines that might help lower breast cancer risk, especially in women who are at high risk. Hormone therapy drugs are typically used to help treat breast cancer, but some might also help prevent it. 2 drugs, tamoxifen and raloxifene, are already approved for this purpose, although concerns about side effects have limited their use. I have been taking tamoxifen for 5 years. Aromatase inhibitors such as exemestane, anastrozole, and letrozole are also being studied to reduce the risk of breast cancer. Phenretinide, thank you, a drug related to vitamin A, is also being studied as a way to reduce the risk of breast cancer. In a small study, this drug reduced breast cancer risk as much as tamoxifen itself. Other clinical trials are looking at breast cancer reduction as an unintended effect of drugs used for other reasons. Drugs currently being researched include biphosphonates, drugs for osteoporosis, and statins such as atorvastatin and lovastatin, which are used to lower cholesterol. Dietary supplements are also being studied to see if they can reduce breast cancer risk. These have included grapeseed extracts, folate, omega-3 fatty acids, vitamins B6 and B12. Although some human studies of these supplements have been completed, very little has been published in the available medical literature today. Other supplements now being studied include hydroxytrizol, a component in olive oil, curcumin, and omega-3 fatty acids coupled with weight loss. This type of research takes many years. It might be some time before meaningful results on any of these compounds are available. Many cancer deaths could be prevented by making healthy choices, like not smoking, staying at a healthy weight, eating right, keeping active, getting recommended screening tests. What should you do for as possible signs of breast? What should you look for as possible signs of breast cancer? Signs and symptoms of breast cancer. Knowing how your breasts normally look and feel is an important part of keeping up with your breast health. Finding breast cancer as early as possible gives you a better chance of successful treatment. But knowing what to look for does not take the place of having regular mammogram and other screening tests. Screening tests can help find breast cancer in its early stages. even before any symptoms appear. The most common symptoms of breast cancer is a new lump or mass. A painless hard mass that has irregular edges is more likely to be cancerous. But breast cancers can be tender, soft, or rounded. They can even be painful. For this reason, it is important to have any new breast mass or lump or breast change checked by a healthcare professional experienced in diagnosing breast diseases. Other possible symptoms of breast cancer include swelling of all or part of a breast, even if no distinct lump is felt, skin irritations and dimpling, breast or nipple pain, nipple retraction, the inward turning of the breast nipple, redness, scaliness, or thickening of the nipple or breast skin, and also nipple discharge, other than breast milk. Sometimes a breast cancer can spread to lymph nodes under the arm or around the collarbone and cause a lump or swelling there, even before the original tumor in the breast tissue is large enough to be felt. Swollen lymph nodes should also be reported to your doctor. Although any of these symptoms can be caused by things other than breast cancer, if you have them, they should be reported to your doctor so that he or she can find the cause. Because mammograms do not find every breast cancer, it is important for you to be aware of changes in your breast and to know the signs and symptoms of breast cancer. There is an elephant in this room. It is a void of my most faithful cheerleader and primary caregiver during my breast cancer treatment and follow-up. My mother, the late Mrs. Beverly Turner Allen. Which brings me to close with the awareness of yet another killer disease on the rise. For women in menopause, heart disease. Recent studies have shown that women in menopause are high risk for heart disease and premature death. Based on the loss of my mother and my personal near-death experiences, my final words to you are to make healthcare your top priority. Actively listen to and question your doctors. Consider the medications offered with a serious approach involving research and actually taking the medication. Do not be ashamed of your health issues and tell somebody. Attend or create a support group to bounce ideas around. As a church body, be responsible for each other by forming a walking or exercise group that meet regularly. Hold each other accountable. As a church body, pull together a community garden. Eat from that garden. Check to see if you qualify for Obamacare. Take advantage of free clinics and free breast exams. If you don't know how to go about doing this, then come to see me. I'll be glad to help you. Finally, and most importantly, do not deny stress in your life. Be active on all accounts, and most of all, be encouraged. Thank you. Good afternoon again.